Do you know that your dog could be at risk of opiate poisoning? I recently talked to someone who was walking their dog near where I live. Their dog was poisoned by fentanyl. So the drug health crisis, now it's a thing for our dogs. These are the signs and symptoms, most importantly, what exactly you should do. Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets. Last year in Canada, the US, 150,000 people died of drug overdoses. Most of those, over 75%, were opiates, meaning fentanyl and the like. But unfortunately, and in some cases, this has even affected our dogs. In many instances, it's working dogs. I mean, these are dogs working with law enforcement, and they're getting exposed to these illicit drugs. In some cases, it's dogs that happen to be living in the houses, the areas where these drugs are being produced and sold. But then there's just the general public, aka you and I, taking our dog out for a walk in the trail, and then our dogs are getting exposed. Dogs can be exposed through inhaling, through ingestion, even just skin contact. The local dog walker I met, their dog actually was up on a trail, ran off the edge of the woods, came back with toilet paper. Much of the opiate doesn't get fully metabolized, and this dog ingested a serious amount. But your dog can get it on their feet, their nose, their fur. They then going to groom themselves. They can then absorb the opiates that way, have this toxic clinical signs. But a big problem now is fentanyl and all these other synthetic opioids. They are extremely toxic and potent. So just teeny amounts, even micrograms, that could be toxic to your dog. The one good thing in this is that our dogs, they're far less sensitive to the opiates than people are. In fact, it takes about 10 times the amount of fentanyl to sedate a dog as it does to sedate a person. And I regularly used to use fentanyl in veterinary practice. We used to use it as a form of a painkiller, especially animals that had a big surgery, i.e. an ACL surgery. We clip up a patch of hair, and we had fentanyl in the form of a patch. We'd glue it on, slowly get absorbed in through your dog's skin, and it did provide good pain relief. But that's an appropriate, safe, calculated amount of fentanyl given through the skin. In that case, yes, then it's safe for our dogs. When you start looking at some of these big, super toxic, potent synthetic opioids, and they either get exposed to it, they ingest it in large quantities, where just micrograms can be toxic, I mean, that's the issue now. And what I was just find so disturbing is here's someone walking on a trail right near my house, just taking their dog for a walk, and their dog gets poisoned. Like, how is that? Secondarily, like, what else do we need to be concerned about with our dogs? So the most important thing you can do is recognizing that there's a big problem and acting really quickly. What are some of the signs and symptoms of opiate poison in our dogs? Number one, and this can happen really quickly, the biggest clinical sign is affecting your dog's breathing, respiratory tract. And this can happen really quick, within just seconds to 15 minutes after initial exposure. Your dog's breathing rate, it really slows down. In some cases, they can completely stop breathing, maybe really shallow, even difficult to tell they're even breathing. And you'll just see their chest is not even really moving, right? You're hardly seeing the chest wall rise and fall. Next, you're going to see CNS depression. Your dog is going to be really lethargic. And in some cases, they could actually be into a coma. If you put your finger in over top of your dog's heart, you may feel that there is an extremely slow heart rate called bradycardia. Likely, they're going to feel extremely cold. You're going to feel their ear tips. It's really cold. They could actually be hypothermic. If you lift up their lips and look at their gums, often they have really low blood pressure called hypotension. These gums may be extremely pale. If you put your finger over top of the gums, hold it down, it's going to take a long time before the blood pressure refills, a really delayed cap refill. Often they're going to be really weak and wobbly, also known as ataxia. And last thing you're often going to see, if you open their eyelids, look into their eyes, the pupils are going to be myotic. They're very small and pinpoint. All those signs altogether really points towards opiate poisoning. Just really think about a dog being under extreme general anesthesia. I mean, that's what's happening. Like, this drug is fully sedating your dog. It's affecting his brain, his nervous system, right? So his breathing slows, if not stops. His heart rate slows. He becomes extremely less responsive, lethargic, etc. And you see that, especially in a really quick period of time, like big alarm bells need to go off and you need to act. So the big principle here is number one, you not getting affected, like because there could be opiate powder on your dog's fur, their paws, etc. So you not touching it, so you get poisoned. And then secondarily, getting your dog into a clinic or somewhere where they have a reversal, i.e. naloxone, that's like the only thing that's really going to treat it, along with supportive care. You need to recognize it, not put yourself at risk, and get your dog treated as soon as possible. So in the field, say these are first responders responding to a situation, say a dog, working dog, say a police dog. I mean, they're thinking safety first. They're using gloves, right? So they don't get topical exposure at all. And second, even if they have option, putting on a mask as well, so they're not inhaling anything. You may or may not have gloves. If it's winter, you probably do. If not, you probably don't. So just think of protecting your hands or your arms just so you're not directly touching your dog's fur in case there's like opiate powder on them, so you don't want to contaminate yourselves. Or just even wrapping your dog in a coat or whatever you have, and then picking him up. Because what you're trying to do is get your dog to your car, get into the emergency clinic ASAP. And it's not like you got to call and wait for an appointment. Just drive right there to the emerge, because in a pretty quick period of time, they can go from being like sedated, lethargic, to just completely have just not breathing, respiratory arrest. So they need treatment, so you need to get to an emergency clinic ASAP. If this is in the field, or perhaps you're in a urban area where there happens to be a naloxone kit, naloxone can be used. So the dog dose is 0.02. It decided to interject. So the dog dose is 0.04 mg per kilo, which means that a 10 kilo dog, as the 22 pound Tula is, you would get 0.4 milligrams of naloxone injected in the muscle. Then the other option, if there's an aerosol way to give the naloxone, put that into one of the nostrils. And the naloxone, it can be repeated every 2 minutes until like your dog is starting to breathe normally again. Obviously, those are the biggest things, right? We're counteracting the effects of that drug. In the field at a clinic, they then would be providing oxygen, intubating your dog if they weren't breathing so they could breathe for them. Most of the time, putting something like a mask on and a bag and bagging them. And if they were breathing great, they're just still putting oxygen on them, turning the oxygen rate up, 2 to 3 liters a minute. The big thing, we're counteracting the effects of the naloxone, supporting the respiratory tract. Then the last big thing, especially emergency personnel will be doing, is decontaminating if possible. So having even like a little fine microfiber towel, which absorbs and picks stuff up. So they'll be wiping your dog's muzzle, wiping his nose, wiping his paws, and the areas where I think the opiates might be. Those similar steps are also going to be repeated at a veterinary hospital. Then they also have the ability to do blood work, to do electrolytes, get your dog on IV fluids as well, counteract some of the other effects, i.e. the low blood pressure, the hypertension. They would be using the naloxone. They would intubate your dog if necessary, providing oxygen. One other big tip here is if naloxone is unavailable and you're in at a veterinary clinic, they can use this older narcotic called butorphanol. It's one I even used to use in practice. This is when it actually works to counteract the effect of fentanyl and all these synthetic strong opiates. So the butorphanol dose is 0.4 milligrams per kilo, meaning a little 10 kilo Tula should be getting 4 milligrams of butorphanol. Quick action can make a huge difference between life and death, but also just taking in mind some of those points I brought up. Number one, you recognizing it. So it's going to happen. The onset's really quickly. It's going to first affect your dog's breathing, getting really depressed and low. You're going to see them like be disorientated, but confused, maybe really lethargic and sedate. Just think having this high exposure to a type of anesthetic, right? Pretty quickly, they're going to get sleepy, their eyes closed, weak, wobbly, ataxic, the slow heart rate, all those secondary clinical signs. Being aware of how fast that can happen. I'm assuming you don't have access to naloxone or anything like that, so you need to get your dog to a clinic ASAP. But just making sure you're not also putting yourself at risk, right? So think it could be on your dog's paw for maybe he ingested some of it on the side of his mouth or his muzzle, right? So just making sure you're covering your hands as best you can, wrapping maybe your dog up, holding your dog up like this so you're not getting exposed to it. Hopefully you don't have bare arms and hands. Getting your dog to your car, to the clinic ASAP. I hope it never happens to your dog. Hope it never happens to my dog. Just really important though to be aware of it. Thanks so much for watching this edition of Veterinary Secrets and the opiate poisoning affecting our dogs. Click up there to subscribe, hit the bell to sign up for notifications. Then when you click that link directly in the box below, I can send you a copy of my free book.